Hello, everyone. We're just going to wait a couple of minutes. I think some other people are coming in and still connecting to audio, so let me give them a couple of seconds to be able to join. Well, hello, everybody. I want to welcome you today to our Innovation, Equity, and Exploration webinar presentation. My name is Nada Shoemaker, and I'm the Equity Strategies and Partnerships Manager for Voices for Healthy Kids. I'll be facilitating the presentation session today. A couple of housekeeping items I would like to share with everybody. This session today is going to be recorded, and the slides will be sent out after the training series is over. We would ask that all of you keep yourselves on mute if you're not speaking. This helps us ensure good audio quality and sound quality throughout the presentations. If you need assistance or technical assistance during the call, please send a quick private message or direct message to Andrea Guarnero, who is our tech wizard, and she will be able to try to assist you, or you can send me a direct message if not, and I'll make sure she gets it. We'll also be having a Q&A session at the end of this series, but if you have any questions, you can put them into the chat. And then what we'll do is try to monitor those and share those either right after an individual's presentation and then also at the end. We might not get to everybody's questions, and if not, we'll make sure that we document them so that we can connect with you via email afterwards in the coming week. At this end of the session, we'll be sharing a brief survey, and we ask all of you to take 2 minutes to complete it. I know that it doesn't take even maybe 2 minutes to complete it, but this feedback really helps us to improve in our future webinars. And so I really want to thank you in advance for doing that for us to help us. So as we get started today, I want to introduce the 3 speakers that we'll have. Our first one is Kelcie Silvio, who's our Senior Policy Analyst for Voices for Georgia's Children. Kelcie is passionate about making generational impact, not only improving a child's current circumstances, but also the trajectory of their entire lives. She leads Georgia Voices Nutrition and Early Care and Education initiatives, where she leverages her background in early childhood development, social work, and public health to inform policy. Our second speaker is Robin Busey, who's the director of Just Health Partnership for Southern Equity. Robin provides leadership and day-to-day management of the Partnership for Southern Equities, or you might hear it as PSE, Health Equity Portfolio. As the Just Health Director, Robin leads the design, development, and implementation of health equity training, technical assistance, and other communication and education resources for communities, organizations, and other stakeholders seeking to understand and operationalize health equity. And our last but not least speaker is Parisa Narazi, the co-founder and executive director of Empower DC. She has led grassroots organizing efforts on a range of issues, including childcare, housing, land use, environmental justice, and racial equity since 2003. Parisa's work centers on building community power to advance equitable development by ensuring impacted community members are the visionaries, drivers, and beneficiaries of land use decisions disrupting current patterns of harm and displacement. At Empower DC, Parisa has incorporated arts, science, legal, historic preservation, and other strategies to bolster organizing efforts. She is particularly proud of her 20-plus years of work with Ivy City residents to win public use of the historic Alexander Crummell School as a community center and park long desired by residents. Parisa's Iranian American heritage, her daughter Aziza, and her love for nature are inspirations for her work. All 3 of these individuals did an excellent job in leading their work groups, and we're going to hear first from Kelcie Silvio. Thank you. Kelcie?
Yes, let me go ahead and share my screen. Okay, is everyone looking at the PowerPoint?
Yes.
Okay, just making
Yes.
sure. Great. Okay, hi everyone. I'm Kelcie Silvio. Nada did my intro, so I think I can just skim past that part. I am with Voices for Georgia's Children, so we're a statewide advocacy and policy organization. And we're the only one in the state that focuses on whole child portfolio, so that's really exciting. And my areas, like she mentioned, are the early childhood development and anti-hunger space. I'm going to start myself a timer because I am a chatter. So I will do that for Voices for Healthy Kids. Our project that we focused on was around healthy hydration opportunities for the early care and education settings, and really trying to figure out what that looks like for providers and from the policy lens. So I will be talking through the background of what that space looks like, what our work group composition and selection process looks like, our methodology and our research, and then our overall findings and recommendations. And if I say something, I'm not sure what the participant your backgrounds are for participants. So if I say something that is information that you already know in the ECE space, I do apologize, but for some of you that don't know too much about the ECE space, I'll dive a little bit deeper into some of the basic information. So the population that we were looking at was the early care and education space. And we wanted to make sure to have a good understanding of what that looked like. And so across the country, there are more than 12 million kids that are aged 0 to 5 that are cared for and also educated by nearly 250,000 staff. So that's not just the teachers in the classroom. There are all kinds of staff that are interacting and engaging with children in and out of classrooms from the second they walk through that door. And so really understanding when you're talking about policies that are going to impact that whole program, what that looks like top to bottom. And whenever we're talking about healthy hydration, we wanted to kind of break that down into different areas. It's not just sort of beverage consumption. We wanted to think through really, one, supporting the access to and the intake of water and age-appropriate nutritious beverages. So when we think age-appropriate nutritious beverages, that 0 to 5 age range really breaks down kind of in a granular way into even certain months of when you can have water or when you can have milk, what types of milk, how much milk, what types of juice, how much juice. So there's different nutritional components and serving sizes and things like that. So that really played a part into our research that we did. The second is limiting less nutritious and eliminating non-nutritious beverage intake. And then the last is increasing access to and providing safe drinking water. The key word being in that is safe. So it's not just making sure that kids have access to water when they're outside and it's a hot day. It's making sure that the water that they're ingesting and have access to and interact with is always safe. So our work group, the purpose of it was really to convene subject matter experts from across the country and make it multi-state and have them and us talk through what those barriers and facilitators are to early care providers incorporating these types of policies or practices in their program, and then creating some type of policy menu for anyone across the country in this space to look at and say, this kind of works for us, this one doesn't. We didn't want to make it just really narrow where it only worked for a certain type of demographic. And that really leads us into our composition. So we wanted to make sure the composition of the work group was really diverse in geography, political landscape, and sector as well. So we had 13 representatives ranging from research, advocacy. We had nutrition and physical activity experts. We had state agencies. And then we were really fortunate enough to get childcare resource and referral staff. So ideally, we would have had providers, but we know in general, and after the pandemic, that providers were really taxed on just all of their responsibilities. And so we tried to get some providers, but landed on the next best thing, which was a CCR&R, a couple CCR&R staff from different states. And not to put their role lightly, I'm going to give a few examples of what they do, but they work with technical assistance with providers. They act as food program sponsors. Some of them offer different business supports, education, but all states have them. They serve regionally. Different regions of a state will have different CCR&Rs cover different regions of the state. So they're a really big resource for providers, and they work really daily with those individuals. And so it was great to have that resource since we couldn't work directly with the providers. And then geographically, we had, you can see on the map, I kind of starred the regions that we were able to cover. We tried to get all the regions covered, but weren't quite able to. But it's the REL, it's Regional Education Laboratory, but it's administered through the Department of Education. It's a research arm. So we really wanted to make sure that we were engaging those education stakeholders and state agencies that are involved in kind of pushing education policy, and wanted to make sure to have kind of a clear delineation in what those education regions were and have some representation there. And then lastly, political landscape. Being from Georgia, our state makeup looks different than our federal makeup, and we wanted to know that those participating in our work group, whether it was similar or different, could take back some policies and and ideas that worked for them. And then also Voices for Healthy Kids had some ideas for people in states that weren't participating in the work group. So our methodology was, we called it a modified Delphi technique because it didn't meet, all the strenuous qualifications of one. But basically, we had our literature scan and our work group feedback. So while we were doing our monthly conversations with our work group, we were also running a literature scan in the background that was supplemental to really inform where our conversations in the work group were going, fill in some gaps, kind of figure out where we needed to have some presentations or guide our conversation. And likewise, the work group was also doing that for our literature scan. So we were able to expand some of our search terms and figure out, what was happening in reality that maybe wasn't being covered in the literature. Where was there a gap there? Or did we not really have our search kind of as honed as we thought we did at the beginning? So the experts were really helpful in that situation. Into the findings. So we had 6 main findings. The first 4 were that CACFP, which is the Child and Adult Care Food Program meal pattern, can support the implementation and expansion of healthy hydration practices. State programs and policies can bolster CACFP guidelines and support statewide healthy hydration implementation and expansion within ECE settings. State policy incorporation of CACFP guidelines and expand statewide access to healthy hydration practices in ECE settings. State programs and policies can support lead testing and remediation and increase access to safe water for children in ECE settings. And then our last 2 were culturally and linguistically appropriate healthy hydration education are necessary for ECE program buy-in and success. And then lastly, which is probably not that surprising, is a multi-pronged approach, including training for ECE staff, education for families, and consistent messaging, financial sustainability, and targeting vulnerable populations with culturally appropriate intervention is the most effective strategy. I say the last one's probably not that surprising for many of you because this work's not done in a vacuum. And so we know that kind of siloed approaches isn't always the best strategy. Sometimes we can't get away from it, but if you have all of these resources, which oftentimes we don't, but if you do, it's nice to incorporate different pieces to it. So all of that to say, those were our findings. And we've found that there were a number of different mechanisms that you could leverage to get to the goal that we're looking at, which is increasing those behaviors. The first is this federal one. And it is what I just mentioned, and it came up in a number of those findings, which is the Child and Adult Care Food Program. So CACFP, if you're not familiar with it, is the child care and after school version of the school lunch program. It's a reimbursement program for meals and snacks for child cares and after school programs and adult programs as well. It has a meal component, which talks about the food, but it also mentions the guidelines and requirements for beverages. So it tells you the nutrition component and the serving sizes for beverages. So it speaks to the water, the juices, the milks that I talked about earlier. And so Georgia, some ways that some states were doing it. Georgia has a requirement in their childcare licensing that says all licensed childcare providers should follow CACFP. Washington was in our work group. They also shared that their providers are required by licensure to follow CACFP. So that's some ways that states are following CACFP and leveraging that federal mechanism to incorporate healthy hydration into their programs. Some state options are the quality rated and improvement system, which all states have. It is a voluntary program, so licensure is required unless it gets a little granular, but unless a program is exempt, and there's all these qualifications for exemption, but generally we'll say licensure is required unless you meet the qualifications for exemption. Quality rated is fully voluntary. So a program could opt in to have their program assessed for quality. And a lot of things go into that assessment. So they look at your interactions with your children, your curriculum, your space, and things like that. One of the things that some of those programs look at is food, physical activity, nutrition, meal plans, things like that. Not all states, because again, it's up to the state what is in their quality rated program. However, we found a number of states are using their quality rated program to incorporate healthy hydration opportunities. So Georgia, Michigan, New York, Montana, those are some states that weave in CACFP into their quality rated and have it as under compliance. But there are a few states that have gone further, such as Colorado or Iowa, and say it's not just that you're following some of these nutrition or beverage standards, you're pairing it with training or education or goal setting, which we saw in some of our findings can be a bit more successful. And then a little bit further down, we saw that whenever we're talking around that beverage piece, water, as opposed to just following some beverage ideas, kind of around having water available. And we saw that North Dakota, for example, is one of those. And in our research, and this, I should have said this at the top, this was just on some of the literature scanning that we did and talking to our work group. So I don't want to say this is an end all be all for what's out there. If you're on this call and you know your state's doing something different, or your state is going above and beyond what I've stated, please feel free to correct that. So I want to make that clear. The only state we were able to find in the literature that had specified safe water access in their quality rated was Utah. So that's something that was exciting to see, at least for Utah, and really interesting to kind of follow in time. And then the safe water legislation is another big one. So trying to figure out where you can kind of leverage your relationships with legislators and things like that. We saw that Alaska and Kansas were two states that were doing some movement around legislation with requiring safe water access for childcare programs. And you can really figure out how detailed you want to go, depending on how involved your network and your legislator want to get. There are some states that have gotten really in the weeds and fleshed out some of their legislation, going as far as timeliness for remediation, what the lead standards need to be, and things like that. New York, New Jersey, Illinois, those are some examples that we found for having really strengthened their lead safe water legislation over the years. And then lastly, in that bucket, we have water testing and remediation programs. You may have heard over the past few years, the EPA has been making available a lot of money to address this space. So that's something to kind of keep in mind as you're trying to figure out what funds are available, because funding is a big part of equity and making sure that if you're enacting a policy, you're also kind of putting some funds for the providers to be able to do it. Organizational mechanisms. This is something that we didn't find a lot of state-specific examples. It was more so just finding it things saying that role modeling was really important, and kind of getting some feedback from programs saying sort of what was helpful for them, or some pilots being run, and letting us dive deeper into our work group conversation around what's important for your specific programs policies. On, do you decide whether to not allow outside beverages to come in? And I think it's really subjective on how a director may decide to run their program. And then the nutrition education piece, I think, is really important for staff, but also for the overall community. Virginia was in our work group, and they do a really great job. They have a statewide campaign called Rev Your Bev, and they engage ECE and K-12 teachers to help write curriculum and promote water intake and consumption. So those are just a few examples of that. And then lastly, the multi-pronged approach is kind of figuring out where you can pick and choose different buckets and mechanisms to do that. Kind of figure out what mechanism you're going to go with. Then you will be able to go and kind of decide which policy content area you want to go in, whether it's beverage regulation and nutrition requirements, water safety, a combination of the first two, staff education and training, family education, and then the cultural and linguistic competency and equity piece is important. But I knew I was going to run out of time. I have some examples for those 5 policy content areas in the next slide, but I'm going to stop my presentation since I did hit time. And I assume these slides will be shared anyway, so I will stop sharing my screen and then just have them shared at the end. And if we have questions, we can kind of chat through them. Does that sound good, Nada?
Sounds great. And we will be sharing all of the slide presentations with participants. Okay, I think we'll turn it over to Robin. Robin?
Hey, thank you. And while Andrea is pulling up the slides, I will say good afternoon again. My name is Robin Bussey, and I serve as the Director of Just Health at the Partnership for Southern Equity here in Atlanta. And our focus similarly was on healthy hydration, but we looked at policy recommendations specifically for the state of Georgia. And we had a specific lens looking at policies that reverse or the kind of counter marketing that is directed toward Black and Brown youth. So that was kind of the focus of our group. So next slide. Okay, so again, the Partnership for Southern Equity, this is our mission. We advance policies and institutional actions that promote racial equity and shared prosperity for all in the growth of metropolitan Atlanta and the American South. And we do this through our equity ecosystem that focuses on several areas: health equity, of course, energy equity through our energy portfolio, growth and development through our Just Growth portfolio, economic inclusion and workforce equity through our Just Opportunity portfolio, and then our Yes for Equity portfolio, which is our youth power building portfolio where we actually employ about 13 young folks ages 14 through 24 who actually worked with all of us, and they were a critical part of this particular project. So when I talk about this work, it's a team collaboration between Just Health and Yes for Equity. Next slide. So our work group, similarly, we mobilized broad expertise. We had folks, although they are primarily based in the Metro Atlanta area, they worked in different spaces. Some worked directly with young folks, some did not. Some were in the health space, some in the social services space. But again, we want to get as many perspectives as we could to really think about how we can, make sure this process was equitable and that our approach was equitable as well. Looking at the social determinants of health and how we could advance local and state policy agendas. Again, it was multi-sector, multi-organizational, and what's important to us, it was intergenerational. So we had lots of young folks be a part of our work group and make sure that their voices were centered. And they were, of course, folks that are closest to the problem, because at PSC, we do believe that those closest to the problem have the solutions. And again, our intention was to elevate their voice into the decision-making. So they helped with the research and with the policy recommendations as well. Next slide. So the work of the group, again, was to look at those predatory practices and the history of soda companies in the South. Again, we're in Atlanta, so CocaCola is right around the corner and they rule everything basically in Atlanta. And we want to look at their marketing, and we want to look at how, they are sort of kind of the behemoth when we're looking at these policies, how we've not been successful in this state to really kind of reverse the sugar sweetened beverage marketing and kind of lobby that they all have and really try to elevate healthy hydration. So we looked at how sugary drinks are marketed to young folks, in particular Black and Brown youth. Looked at policies and new opportunities that could exist to ensure that healthy hydration is accessible. Again, coming from the equity perspective, what would be necessary to ensure that safe, accessible, and affordable water and healthy hydration was available for all. And then strategies and messaging to support community consumption of healthy hydration. Next slide. So we, of course, as all things, we start with data. So we went and looked at what we could find. As you see, some of these numbers are old. So a lot of the data that we were able to find was not necessarily current, but this is what we started with. So we looked at, most youth, at least 50% of youth drank a sugar sweetened beverage on any given day. On average, US youth nationally consumed 143 calories from sugar sweetened beverages, and adults were right there with 145. And again, as you might expect, among youth, the intake is higher among boys, among adolescents, non-Hispanic Black youth, or youth in families with low income. And the same was true for adults as well. So again, we looked at this landscape, and we know that this is true, that most folks that live in a low income community tend to be folks of color. They tend to not have very many options for healthy food, let alone healthy hydration options. So there's a corner store almost anywhere. And if you go into the corner store, you can probably get, you used to be able to get 2 juices for $1. You can get Cokes, at a reduced rate. So it's really easy to make sugar sweetened beverages your primary option. So we really want to take a look at that and see how we could start to reverse that trend. Next slide. In Georgia in particular, almost a quarter of young folks under the age of 18 had at least one sugary drink per day. And that was in the past week when that particular data was collected. About a third of Georgia's youth under the age of 18 are overweight or obese, and that number is much higher for adults. As I said before, these companies tend to target young folks, in particular Black and Brown youth. If you start as a child, you start with the animation, you start with the cool commercials, you start to create a customer for life. And sometimes as children go, the adults follow as well. So we see all that marketing looked like the tune of $1.04 billion to advertise sugary drinks. And I just want to sit there with the 1.404 billion with a B dollars to advertise sugary drinks. So if you think about it, you look at any youth directed or youth targeted promotions, looking at television, social media, there's almost always a soda commercial or something about some juice or some drink that's going to give you all this energy. They're all over the place, versus about 219 million spent on advertising, marketing water and 100% real fruit juice and other healthy hydration options. So again, when we look at it by race, those that tend to be targeted toward Black and Hispanic youth, there was a lot more money poured into the advertisement of sugary sweetened beverages. And particularly in Spanish language television, as you see here, that rose to 84 million in 2018, which is an increase of 80% just 8 years prior. Next slide. There's one before that, but that's okay. Yeah, that one. So again, we are in Atlanta, and it's one of the first things you see when you roll into Atlanta is a huge Coca-Cola sign, because again, Coca-Cola is everywhere in Atlanta. And so we took a look at their marketing. We took a look at how they described their marketing, and we actually this is where our young folks came into play as well. They actually looked and pulled examples of that youth targeted marketing. So we saw a lot of marketing with folks dancing, smiling, hanging out with their friends, things that are appealing to young folks that they want to be a part of. So, despite this beautiful statement by Coca-Cola, we actually see that they are very much targeting young folks and Black and brown folks in particular. Next slide. So if we look at Coke, of course, we had to look at Pepsi, and they were not very different at all. We know that they have lots of commercials targeted to young folks. Of course, this particular example, and when you get the slides, you can click on these links and they are actually live. This is Cardi B, who is, I'm sure most folks probably now, no matter what age you are, heard of Cardi B. Very popular among young folks. She's cool, she's hip, she's, has the saying, the all of this in this particular clip. And so again, we're looking at how they're strategically marketing toward young folks, what's cool, what's hip, what's out, what's current, and how we can start to see how we can start to raise healthy hydration options as the better choice. Next slide. So we looked at this particular approach to reducing sugary sweetened beverages consumption, and we found these 4 areas: financial, increasing the price relative to healthy hydration options through a tax or incentives for healthy hydration, making, again, the sugary sweetened beverages the last option or the least popular option in this particular point, the least affordable option. Information, reducing exposure to sugary sweetened beverages and highlighting the health risks. So similar to cigarettes, is there a way to put on the packaging to let you know this has X amount of sugar? This is what this can lead to. This is how this can affect your health. And defaults, making healthy hydration the automatic choice. So when you go to a restaurant or you're at school, then the option that comes with your meal is water or some other healthy beverage, 100% fruit juice or milk. And then availability, reducing the portion sizes of the sugary sweetened beverages. So going away from those kind of big 16, 20-ounce bottles to 12 and 8 ounces if you have to have sugary sweetened beverages as an option. Or of course, our preference is to decrease access all the way around. Next slide. So we looked at, in our research, the Change Labs, the blueprint for change makers, and we saw that with them, there are 3 ways to really improve health through law and policy. There's legal integrity, legal innovation, and legal intervention. Of course, legal integrity is upholding just policies. Innovation is creating new policies, and intervention is changing existing policies. And what we found is that none of these are able to really exist on their own. You have to have some combination. If you're going to be upholding just policies, sometimes you have to make sure that you're changing some existing policies and really lifting up the just policies that are available. Innovation, of course, creating new policies. So that might mean, again, changing existing policies to be able to create something totally new, to be able to get these policies in place to further not just equity around sugary sweetened beverages and healthy hydration, but health equity all over. Next slide. Oh, I had our policy recommendations there. There they are. So again, through those lenses, we came up with 3 general areas of policy recommendations. So our first was youth access to healthy water. We found that in Georgia, there are very few, if any, real programs to promote healthy youth access to healthy water. For SNAP beneficiaries, there was what was called the Hydrate My State, and it was really aimed at lifting up water as a better hydration option versus sugary sweetened beverages for those who are SNAP participants to maybe, increase water intake in their diet. So it was not targeted statewide. It was not targeted to everyone. So we wanted to make sure that we could take that particular policy and elevate it. And of course, look at policies in schools and how can those who are participants in the lunch program, how can we make sure that they're able to provide access to healthy water? And as Kelcie mentioned, we're not just talking about water in general, we're talking about actual healthy water. So water that does not have lead, water that is clean, water that is affordable, something that really makes sure that everyone, regardless of who you are, where you are, you're able to have access to healthy water. Our second recommendation, which falls into the legal innovation space, is the Georgia Equitable Sugary Drink Taxation. So our favorite word in Georgia, just kidding, is taxes. So how can we make sure that those beverages that are, of course, targeted to young folks with all of that sugar, all of those unhealthy aspects, actually have to be the least available option? So how can we make those more affordable? Is it actually putting tax on those particular drinks? Is it offering incentives for other options? What can we do to make sure that through that financial lens, that there's a way to make sugary sweetened beverages the less attractive option? And also through this particular taxation, this recommendation, we were thinking that there were basically two areas that particular tax could support, of course, reducing the sale and consumption of sugary sweetened beverages, but also generating revenue to use for other community-based programs. So community programs that might, of course, help with the access to healthy water, might improve other health equity issues in our state. So that was kind of one of the favorites of our work group. We like that tax, similar to the tobacco tax. We've seen that be successful. So our recommendation was to try something like that in Georgia as well. And then, of course, our third recommendation was, again, falls in the legal intervention space, adoption of policies to restrict sugary sweetened beverages marketing to children and youth. So how is there a way to, again, elevate healthy hydration, particularly water, as the healthy option? Are there ways to, again, inform children, inform their parents about the health risk of sugary sweetened beverages, or the health benefits of healthy hydration and water and fruit juice and the like? We hope that the state could implement the USDA's local school wellness policy. So how can we require that foods and beverages meeting the smart snack standards are the options for children? Additional strategies to reduce marketing and advertising to children, policies that prohibit sugary drink coupons. So prohibit those incentives, prohibit some of that advertising, particularly in stores. In some schools, you go to some school campuses and they're set up offering t-shirts, free drinks, coupons, and the like. How can we make sure that is less available to children and young folks to make sure that they reduce their sugary sweetened beverage consumption? That's a mouthful. So essentially, all of this work, next slide, is contained all in our final report, and there's lots more information. But what we wanted to drive home is that this particular project, again, was a joint collaboration between Just Health, so looking at the health equity lens, but also making sure our young folks were at the center of this. And part of this work was also done in conjunction with another project that we were working on around oral health equity, which is a huge issue in Georgia and the American South, and really looking at the tie-in between the increase in the consumption of sugary sweetened beverages and oral health equity, and where those disparities existed as well. So our young folks, being the great young folks they are, they came up with a beautiful video that I don't have access to, but we'll make sure I get to share with you all, to really show how sugary sweetened beverages and oral health equity work hand in hand. So with that, I will stop and I will turn it over to Parisa.
Hey, everybody. It's been great to hear about this wonderful work so far. Thanks for having me. I'm Parisa Naruzzi, Executive Director of Empower DC, and we were grateful for the opportunity to convene the working group exploring strategies for advancing racial equity through policymaking. And you can go to the next slide. So the question that we were asking with this effort was, how can racial equity be advanced through policymaking? what are some racial equity policies that are emerging around the country, and how can racial equity policy making build power for impacted communities. We'll go to the next slide. And this is a definition of racial equity provided by a national organization called Race Forward. Racial equity is a process of eliminating racial disparities and improving outcomes for everyone. It is the intentional and continual practice of changing policies, practices, systems, and structures by prioritizing measurable change in the lives of people of color. And one of the key things that we talked about throughout this process is how racial equity is both a process and an outcome, and that the processes that we use through policy making have to be equitable themselves, because an inequitable process cannot lead to an equitable outcome. You can go to the next slide. This is a snapshot of some of our participants in our working group. The way that we led this effort, we had 5 members of Empower DC who assisted me with just designing the whole outline and program. And these are folks who represent our constituency of majority Black and Brown, low moderate income residents of the District of Columbia, including public housing residents and others who have been affected by housing instability and just the cost of living and impacts of gentrification here in DC. We were able to put out our call for participants through a few different networks that we're part of that involve other organizations that are also working on social, economic, and environmental justice throughout the country. And we were lucky to have good participation from the folks that you see here. You can go to the next slide. And we came up with a series of topics and met, monthly to explore these different topics. So our method was to hear from different speakers and to look at racial equity policy making within different frameworks, whether it be community engagement, certain government structures, or within certain types of issue-based areas like policing, like budgeting, like zoning and development. Next slide, please. So getting into the recommendations that came out of these discussions, as I mentioned, we covered a broad range of topics, but again, with always looking back at that core of how are we advancing racial equity through this type of policymaking or in this type of policymaking arena. So some of our core recommendations are, I'm going to go through now. Of course, the first one is related to meaningful engagement of impacted communities. And of course, as I stated at the beginning, that process of meaningful engagement is a requirement for any initiative that is aiming to advance racial equity. We talked a lot about moving beyond input. We here in DC, experience this on an ongoing basis where a lot of the city's engagement processes are very shallow. A lot of decisions have already been made before the community is ever informed. And one of our really dynamic presenters, Denise Barreto, presented the following types of co-creation. She talked about crowdsourcing, where you would, invite the community members to contribute at the very onset of a initiative to propose concepts, designs, ideas, and solutions. Co-creation, where there would be a group of people who are directly connected to that issue, working directly with whatever agency or entity to design the outcome. Coalitions, where there may be a group of selected organizations or individuals who have a shared purpose, who are brought together for that effort. Or expert co-creation, where specific experts may be handpicked to help synthesize the perspectives of communities. So in other words, a representative of different populations. So this is just a snapshot in our the way that we developed our report after our recommendation, after our sort of cherry picking the top recommendations. We do go into in-depth the notes and discussion points of all of these sessions, and because we covered so many topics, there's a lot of nuance. But one of the key things that we think about when we talk about community engagement is, of course, the real capacity that it requires. And, you know, as an organization dedicated to community grassroots organizing, of course, I can attest to how labor intensive that really is when you're doing it in you know, with integrity and with intention. Issues like language access, of course, become foremost, and just accessibility of the type of information that you're providing, accessibility of the spaces within which you're convening people to allow them to be involved in decision making. One of the challenges that we often face is community groups being seen as adversaries rather than as allies of government. A lot of times government may be trying to withhold information and making it very difficult for the community members who have, you know, who are stakeholders in an issue to actually know what's going on, to give real input. So there's a lot of barriers, and one thing that we're looking at here in DC is really creating some standards for community engagement to set a baseline of a baseline requirement across government agencies and government programs, because we find that it really hasn't been defined, and it's sort of up to each entity to determine, you know, how much they rely on just posting on Twitter versus, you know, doing more deep, meaningful engagement. So we feel that this is a real need to set some requirements, especially as such a core underpinning of a racial equity outcome. Next slide, please. Another topic that came out throughout our discussions is the use of data and the need for data collection to be ongoing, to be transparent, and to be disaggregated. So to specifically be able to speak to data as it relates to certain populations, of course, you know, Black, Brown, different immigrant communities. But in each community, there may be, you know, other types of metrics that are very meaningful. For instance, here in DC, we would really be interested in data that is disaggregated by DC native status versus folks that move into the city. And that's in part because we find that here in DC natives tend to be more disproportionately impacted by lower incomes and higher housing instability, et cetera. A couple other things that we talked about with the use of data in advancing racial equity is, you know, one, understanding why we need data to help us understand the baseline conditions, and also to be able to measure, of course, progress or regress within the issue, to help us understand if this engagement that we just talked about has been effective, and to help communities know and identify whether their priorities are being heard or met. So if there's no data available, it makes it hard for communities to advocate for themselves as well. We want to emphasize the importance of including qualitative data, so not just, you know, measurable numerical data, but also the real lived experiences of people most directly impacted. We also talked about the need to standardize data across agencies and programs, that if data about returning citizens is being tracked in one area, it should be tracked in another, so that you know, these comparisons and you know, that the data can be more complete. And of course, data transparency. This data needs to be made available to the public, to the community, in a you know, public platform that is easily accessible and easily used by community members. Next slide, please. We also talked about the use of racial equity impact assessment as something that is growing, you know, growing innovation throughout the country. And here in DC, we were able to speak directly to the use of RIAs. And we have a couple of new offices here in DC that are using RIAs. So we were able to outline in our report some of the criteria or, you know, sort of steps that folks are using to construct these RIAs. The idea of a racial equity impact assessment, of course, is to evaluate a policy or sometimes a program or decision to see if it would advance racial equity or be neutral or actually detract from racial equity. And some of the things that are done within this process is highlighting the data that exists on the current racial inequities, bringing attention to history and racial traumas, touching on related research that might be available, and exploring the potential consequences, including, unintended consequences for specific racial groups if a bill was to be passed. There's also the Government Alliance on Racial Equity breaks down the assessment in this way. They recommend that the assessment first identify the desired results, analyze who's most negatively impacted by the action, gather input from those most impacted, develop strategies to advance racial equity that's informed by the above, create the implementation plan, and create a plan for communications and accountability. This is one of the more tricky aspects because, like, for instance, here in DC, as this has been rolled out so far, the RIAs are pretty much just informational. There's no requirement that decision makers not advance something, even if the RIA indicates that it is harmful to racial equity. So they are more or less a tool of expanding conversation and transparency, and could be used really as a tool for community and advocacy to uplift the concerns. But there is no, necessarily legal requirement that, that an action be influenced directly by the RIA. Can we go to the next slide? We also talked about the use of racial equity offices or racial equity officers within different district agencies or government agencies. And here in the district, this is something that is starting to become more commonplace, although it's still very new. And there's a number of, critical agencies that don't have yet racial equity officers. So the idea would be that these offices and officers are the entities required for to ensure that the racial equity lens is being applied across the agencies. They would also often facilitate racial equity planning and racial equity training among staff. Here in DC, the DC Mayor's Office of Racial Equity has this as this theory of change that one, their intention is to normalize by having the conversation around racial equity, to create shared language, to organize, build the capacity to do racial equity work within the government agencies. And a lot of that is based on this training of government staff. Operationalize, incorporating racial equity tools like the RIA, for instance, into their operations of the different agencies, and to assess, to have measurements that are tracked and progress on those indicators tracked, disaggregated by race. I think one of the key things that we are, seeing as a concern right now is, again, just how robust is the capacity to do this in a meaningful way across the government agencies, so that we are not in a position where, again, it's like, oh, we're addressing racial equity because we have this office, yet the conditions that people are facing really aren't substantively being changed. And on my last slide here, we had a really meaningful conversation about reparations. And of course, this is such a nutshell of that. But I think we talked about the fact that in order to really repair our country's long history and practice of racial discrimination, that intervention is required in every government system, that some of those systems are so rooted in racial oppression that we may need to entirely dismantle, rename, or recreate the entity in order to reverse course. That one way that some folks are approaching this is to identify racism as a public health crisis in order to reframe the conversation about racial equity. And we were, happy to have folks from the Coalition for a Just and Equitable California speak about the work that they're doing in California to legislate reparations for Black Americans that are descendants of enslaved people. And they were very clear to uplift the fact that racial equity legislation is not reparations, and that anything that is not related to cash payment issued by the federal government is not reparations. So to be really distinct about how we, that racial equity work is not reparations work, and both are needed. That's my summary, and I'm looking forward to any questions and discussion. Thank you so much.
Thank you so much, Parisa, Robin, and Kelcie. Really appreciate your great presentations. Does anybody, and I can only see part of my screen, so does anybody have any questions? If so, maybe raise your hand or put it in the chat. Maybe if you, oh, there's Logan. Logan, right ahead.
Hi, it's good to see you again. The great presentation, thank you. I was wondering, are you guys starting to look at PFAS and other chemicals that are in these bottled drinks and their impact on children's health? I've been reading a lot about them lately. Thanks.
So I'll start. We haven't officially, and specifically as a part of this work, but through some of our climate and health work, we are aware of it, but we haven't yet tied it to this particular work. So, no.
Thanks so much, Robin and Logan. Kim? You're on mute.
You're muted. No, I'm not. Okay. Great presentation. I'm specifically interested in the beverages in childcare. I actually have a healthy eating research grant right now looking at water access, water consumption, and other beverage consumption in family childcare homes. And one of the things that we're hearing and seeing in my project is that there is a lot of mistrust about tap water. Even and I understand the reasons for that, given the Flint water crisis and other issues in communities. But even when the water's safe, there still seems to be a mistrust of tap water. And in family childcare homes where I'm working, that usually the childcare providers themselves are low income, the families are low income, having to purchase water filters or having to purchase bottled water instead of using tap water, creates a financial burden on these providers. So I'm wondering if that's come up at all, if there's been any discussions about, promoting tap water and the healthiness of, I don't know, just anything along in that space, because I think it's definitely creating a barrier that maybe is an unnecessary barrier that's cropping up in childcare. So just wondering if any of you have thoughts about that.
Kelcie, I think maybe you could address.
Yeah, so first of all, so interested to hear what you find out. I think the family childcare home space is something that has its own challenges. So that's a really interesting research population. We didn't find much in the literature. We heard a lot anecdotally about that. So I think that was a lot of trouble we had, was kind of like that gap in literature in this whole space, like not even just the family home space. But the trust in the water, the communications coming from either the early care agency or whatever the respective water, health, agriculture agency is in the state, the funding around it, and maybe the communication or lack thereof. So like I said, the EPA funding specific, like there's tens of millions of dollars being funded from the EPA specifically for child care testing and remediation, but is there communication happening at the state level? The flip side is a lot of homes are hesitant. We've heard from our state agency to participate, because then what happens if they test and there's an issue, then they're going to have to close their business. So I think there's a lot of layers to it. So that's a tricky thing, because like to get the money, you then have to test poorly for your business. But yeah, we've heard it anecdotally. We haven't seen really what to do in the literature. I think it's around communications. I think also figuring out where community resources are happening. I know I gave the Virginia example of Rev Your Bev. They're a public-private partnership because they're very focused. It's a state agency and they do a lot of community partner programming, but trying to figure out like if your public policy solution is a few years down the line, like where can a community resource fill the gap? I know none of that is like a super helpful immediate response, but we've also heard it, if that's
Yeah.
any consolation. CCR and ours might be a great place to start because it's a child care resource and referral agency. To see where they are in your state, kind of with hearing things, because maybe at least if you can get the data to your state, that might be helpful.
Yeah, and I'll just add another thing too. Another thing that we're hearing too is that there seems to be a lot of confusion about for providers in CACFP about water, and they're very, very, very focused on the milk, like making sure kids get enough milk, and they're saying things like, "Well, we don't give water unless they finish their milk." They're like really concerned about the milk. And so I think there also is an opportunity at the CACFP level to do a better job, maybe in some of the trainings that they do with providers around where water fits in and how it's recommended. And so I think that's another policy opportunity to maybe, better communicate that policy to providers.
Yeah, and you can, I think, we've talked to RCC and RNRs, like you can get reimbursed or provided bottled water through CACFP through the state agency. But again, you have to let them know what your levels look like. And then that's you going to the state agency saying you don't have safe water. So it's this catch-22 of where the equity piece comes in for a business and serving that community, say you're the only provider in the area.
Thanks. So I'm so sorry that I have to cut this off, only because our tech person has to go to another call that she's also providing tech for, and has to also launch the poll that you might have seen show up. Kim and Kelcie, I suggest that you two get in touch with each other after this. I think you have some great conversation to still have, and probably can learn from each other. Thank you, everybody, for joining. Again, if you have questions, please email them to me. We will be sending out additional information in the presentations to you afterwards. So thank you again so much to everybody for joining us today. Take care.